Through the worldwide pandemic of COVID-19, many devices and methods have been implemented to stop the spread of the virus, and among these devices is the MRI machine. The MRI has been useful in studies of the recent and ever-growing cases of COVID-19, making it a key factor in the worldwide attempt to stop the spread of the virus and return everyday life back to normal. But the use of the MRI has not just made its appearance. It was created in the late 1900s through the combined efforts of multiple skilled scientists and has proven to be useful in some of the most important medical fields, undoubtedly creating a new frontier in American history. The invention of the MRI machine, a device able to image and analyze the smallest of anatomical abnormalities, created and surpassed a new frontier in the field of medicine by allowing for non-radioactive scans, providing three-dimensional imaging of any given part of the body, and identifying the causes for bodily issues that were once undetectable. From the early 1800s to the mid-1900s, various diseases plagued American society, devastating the nation and its economy. Diseases like smallpox, typhus, and yellow fever were massive issues taking the lives of many, but in the end, these diseases were eradicated with the help of vaccinations and other antibiotics. But throughout the years, and even up to this day, there have been medical conditions that have not yet been completely cured, specifically conditions like cancer and mental illness. Before the invention of modern devices like the MRI or CT scan, detecting cancer was a much harder task. Common cancer screening tests during this time would be the Pap test and the fecal occult blood test. While both of these tests were still efficient in their own right, they had limited usage, with the Pap test only detecting cervical cancer and the FOBT only detecting colon cancer. And with the rise of other types of cancer, such as lung cancer, washing over America due to a rise in cigarette usage, the devices of the time were not able to keep up. Mental illness would be another issue that would not be cured or even diagnosed properly from the 19th to 20th century. While mental illnesses were correctly linked to a discrepancy in the brain in the late 19th century, the countermeasures to such illnesses would be far too brutal for any effective treatment to be produced. For example, mental illnesses during this time would be dealt with through insulin chemotherapy, which had a 5% mortality rate, metrazole therapy that would lead to seizures causing severe injuries, and lobotomy, which introduced mental and physical impairments to multiple subjects. Cancer and mental illnesses will continue to be massive issues in America until the development of modern mammography, which gave accurate diagnoses of these issues and allowed for the production of proper treatments. 1944, American physicist Isidore Isaac Rabi has discovered nuclear magnetic resonance, or NMR for short, a phenomenon in which magnetic frequencies could be used to measure the movements of atomic nuclei. This discovery on its own provided information about the molecular structure of various solids and liquids, prompting Rabi and two other scientists to receive Nobel Prizes in physics due to this development. But a handful of scientists would realize the potential for a magnet-based device for mammography using the phenomenon of NMR. In 1971, physician Raymond Damadian believed that NMR is not limited to the study of chemical substances, but believed that such a finding could be used to detect cancerous tissues due to the difference in the volume of water in cancerous tissues when compared to healthy tissues. Around the same time, chemist Paul Lauterbur would take an interest in Damadian's published research and realize the potential of using NMR in order to produce scans of living organisms at an extremely detailed level. He believed this could be done by using a large gradient magnetic field to provide two-dimensional image scans through the use of NMR and stacking multiple two-dimensional scans in order to create a detailed three-dimensional scan of the body, which could then be visualized by scientists for the purpose of research. The first attempt in making a machine capable of producing medical scans using magnetism would be executed in 1977. Damadian would create the Indomitable, a large full-body scanner, and produce the first image scan through the use of NMR, which would then be known as the first MRI machine. But this machine was slow and did not produce the desired image quality, which would cause the machine to be unfit for clinical use. During this time, physicist Peter Mansfield would take and improve upon the ideas of Lauterbur and Damadian. Mansfield would fix the issue of poor image quality by inventing the technique of line scan imaging, which provided cross-sectional images, greatly boosting the depth and detail of the images produced by MRI scans. Mansfield would then resolve the problem of extremely slow scans by inventing echoplanar imaging, a technique that used fast-switching magnetic field gradients in order to form images at a much faster rate. In 1977, Mansfield implemented these techniques into a small MRI scanner that was used to successfully scan a finger within minutes. And just a year later, in 1978, Mansfield would create an MRI scanner large enough to image a full human efficiently. From here on out, MRI scanners would be built for regular clinical use, finally crossing a new frontier in the field of medicine.
The first time I went to a scanner when a patient was in and I saw a sagittal image of the head, I had a feeling like vertigo. I had seen, of course, anatomical sketches from a brain, but to see an image of a brain of a person which was right in front of me, that was so outrageous. I couldn't believe it.
With the invention of the MRI crossing a new frontier in the field of medicine, many medical practices were improved on and many developments were made possible. These medical improvements include increasingly efficient and quick scans, with machines like the 3T MRI only taking around 15 minutes to complete screens of soft tissue, muscles, and more. The next improvement to medicine and research is a massive improvement to scan quality in the field of mammography. With a method of producing three-dimensional images through the use of multiple gradient fields and the ever-growing power of MRI machines, MRIs have produced scans that have even been detailed enough to show how information flows between the neurons in a human brain. The third and arguably most notable improvement brought about by the MRI is the development of a scanning device strong enough to create detailed images of living organisms while not needing to use waves of harmful ionizing radiation in order to attain these images. Before the MRI, nearly all advanced forms of medical scans implemented the use of ionizing radiation, which would increase risk of cancer and cause overall harm to the human body. While the benefits of these devices using ionizing radiation still hold multiple positive aspects, the MRI completely takes away any risk of radiation during the scan, making the MRI the safest and most effective medical scanner the world has ever seen. These improvements to the medical field have also boosted the research of many illnesses. Cancer screening is no longer limited to the Pap smear test or the FOBT test, but is now easily done with the use of the MRI. The MRI allows the whole body to be screened for cancer, providing an image that clearly points out any and all tumors in the body, while also ensuring no extra radiation damage be caused in the process of the screening. Researchers now also have a good grasp on the causes of mental illnesses thanks to the MRI. The MRI provides scans of the human brain, allowing researchers to find discrepancies that link to mental illnesses such as depression, Alzheimer's, and many more. With the MRI providing the information needed to identify the causes of numerous illnesses, the possibilities for curing once unknown diseases are now higher than ever. The MRI is still undergoing many improvements and will continue to open the pathway to curing different diseases throughout its use in the medical field. Aside from simply increasing the power and efficiency of the MRI in the future, the MRI is also predicted to revolutionize accessibility to state-of-the-art equipment in healthcare. The main issue with the MRI is its large size and high cost for usage, with the MRI only being accessible to those with money to spare on a higher level of medication. But now, compact versions of the MRI have been created, reducing the cost of an MRI scan significantly, making scans more accessible. While these machines are less detailed when compared to a full-size MRI, these compact MRIs are by no means weak. An example of this being the Swoop Portable MR Imaging System, a portable MRI machine capable of producing images of a patient's brain within minutes right from their bedside. These compact MRIs also don't have the same flaw of extreme magnetism due to having a smaller magnetic field, making it usable in regular hospital rooms or ICU rooms, providing easier access to life-changing scans to patients in severe conditions. The invention of the MRI has created numerous pathways for progress in the field of medicine, ultimately creating and crossing a new frontier in American history.